Hello, everyone, and welcome back. We are here with Heather Edwards for a part two. So that is your
So,
clue. Yeah, welcome.
yeah, I'm so excited to continue this conversation.
Oh my gosh, it was such a good conversation. I just want to thank you for coming back for a part two. And for those of you who are like, wait, where's the part one? Well, that's your clue. That's your cue. Go back earlier in the season to catch part one, where you will learn all about Heather and her amazingness. But right now, we're just going to jump straight into the good stuff. All right. Welcome back.
Thank you. Thank you. Glad to be here as always.
All right, so let's talk about it. We kind of left off about with, what if you need a pelvic floor referral? What does it look like when someone has the additional sexual health counseling background? How do we move kind of away from shame and being able to be open and talk about it with pelvic, floor PT or OT? But then we stopped short, and that's why we needed a part two, because we didn't really talk about feeling safe, seen, and included.
Mhm.
And I know that that's part of your thing. You're known for creating an inclusive space for LGBTQIA plus folks, um, kink communities, complex medical histories. Talk about how you do that first of all, and then I want to talk about like how we know a person, or how a person would know that they feel safe in a space where they're, in a clinic. So that's part two. But part one is talk a little bit about how you've worked to make that an inclusive space and how it looks for you.
Yeah. So the biggest piece of this, I think, is sometimes surprising because it really has nothing to do with the space you're creating with someone else. It has all to do with the space you create for yourself.
Mm.
And so, I was just talking about this with our sex counseling cohort in an office hour right before this, as we were discussing like the so often it's challenging to talk about like taboo or challenging or like against the cultural norm or any of these topics, and especially in a clinic it's hard, but for clinicians, for providers, it becomes really hard if you haven't asked yourself these questions already and if you don't feel comfortable with your own sense of who you are, right? So the biggest thing for providers to be able to create a safe space is for them to have already kind of done their own work around exploring the concepts around like understanding a bigger scope of sexuality, asking themselves things like what is sex for, to for me, like what are my motivating factors, how do I work, what are the power structures that I engage in, when it comes to partners, what are the things that really like make me feel like good and alive, and do I bring that into my sexual health world, or into my sexual relationships, because so many of those things are the things that we're really wanting our clients to be able to access, right? Is that
Mhm.
higher quality of life, right? We want that deeper sense of our erotic self. And when I say erotic, I don't mean like pornographic or just like sexual, like it's not that version of it. It's that like really feeling that deep sense of who you are and what lights you up, right? From
Yeah.
the most delicious cara orange that you might have just eaten that just made you think that all is right with the world, despite often evidence to the contrary, or whatever it might be. But it's being able to kind of like find that for yourself, and
Mhm.
then being able to bring that into all of your experiences of life, and in particular into your sexual experiences, because our sex, like there's so much that's around that tells us that sex isn't for us, or sex isn't pleasurable, or sex isn't this, or we shouldn't do this, or this is dirty, or this is, we've got so many gatekeepers around our sexual selves that sometimes it's hard to actually relax and enjoy it. And so for a provider to be able to create a space for someone else to do that, they need to be able to know how to do that for themselves, because otherwise it's really hard to understand that that space even exists, right?
Yeah.
And then that space becomes very like medicalized, right? And focused on the what hurt, like it, like as if it's your knee or something, right?
Mhm.
Where all of these things still apply to your knee, if we're being honest about it, but it's a deeper sense of challenge when it comes to sexuality things. So yeah, so like that is kind of like ideally what you're looking for, but like that's not exactly it's what someone's gonna put on their website, right?
Yeah.
Here's all the
Yeah.
self work I've done around sexuality.
I know, I know, I know. I mean, can we elaborate? I don't know how we would
Yeah.
elaborate because you listed the questions that they should be asking themselves, but what does the actual process look like? How would a patient recognize that that process has happened? And maybe you're a
Right.
clinician and you're listening, or you're a patient. And you're like, well, I want to do I want to go through this process. What does that look like?
Right. So, oh, it can look like lots of things. It can look like therapy. It can look like a really great friend circle. It can
Mm,
look like some really fantastic, like books. There's so many incredible books. Like Emily Nagoski and Esther Perel are always like those are the two that like absolutely speak to me in all the ways, and I will read every word of every book that they read. And so, finding the people who speak to you, and like really yes, like this is good, this is where I want to go, and then I'm going to actually practice this in my life. But a lot of times you need support, or you need like accountability buddy or something like that to kind of like help you go through and do the work. Definitely I recommend therapy to like help figure out what are your holdbacks and what are the things that are keeping you from accessing yourself and your sex life in the ways that you want. Yeah, there's I have sometimes like erotica can be helpful, or watching different movies that can help you um kind of access different parts. I don't know, Ginger, have you watched Heated Rivalry? Are you in the Heated Rivalry fan club right now?
no, I am not.
So it's all the rage, and I highly recommend it to
Okay.
everyone. But it's a six-part series about a like gay hockey players.
Okay.
Okay. But the thing about this series that like people are watching and rewatching this, and there's so much good like erotic scripting stuff in there, and so many of the experiences are really reparative because they take like all of these things that people are really afraid of, the worst case scenario happening, and then and then it doesn't, and it's happy
Mm.
and it's good and it's fine, and it makes your heart feel like okay, right?
All the stuff we need. Yeah.
Yeah, so kind of like finding those different things, like if something's like really fascinating you or like lighting you up around it, or there's a conversation or a show or a piece of a movie or a dialogue from a book that you just can't get out of your head or something, to like dive into that a little bit more and see what it is. And then some of the things, like I can give you there, I have a what is sex for handout that we could probably attach, and
Okay.
it's one of these things that it's just kind of helpful to understand, like so often, like if someone thinks that, like if you ever have you ever wondered like why is it that I have sex, right? This is not a question we ask ourselves, right?
Yes.
But when you do, the answers can be fascinating. So this is just kind of like a checklist of being able to consider what those reasons are, and some of them might be like for connection with your partner, but some of them also might be like to keep my partner from being so damn grumpy, right? Right? It's
Yeah.
to get away from consequences, or it's because I think I should,
Mm.
like this is my
Mm.
job,
Mhm.
or if I don't, then my partner will cheat on me, or or like there's all sorts of different versions of it. Like, and there's also all the good stuff. Like I want to feel like transcended. I want to like access this great thing that I can't access anywhere else. But sometimes when we can understand those things about ourselves, that can also kind of really help us sort out like where the sticky pieces are and where the points of pleasure really are, if that makes
Yeah.
sense. I mean, this is a hard question to answer because it's going to be a different pathway for like every single person who
Yeah.
experiences it, right?
Yeah. Yeah.
but but asking yourself things like um like using as a journaling prop, like where did I learn about sex, you know what does sex mean to me, like what do I think sex should be,
Yeah.
right? What is sex for me now? What's my best case scenario sexual experience, right? So just kind of like diving into some of that can be really helpful, like and that's for absolutely anyone. Like that would recommend that for providers, but also for patients. But also I want to put out there with the caveat, those things I just rattled off, those questions, like they're no big deal. Each one of those could like put you in a spiral of like, oh my gosh, and it could be really hard to answer that. And like when you start thinking about where you learned about sex, if some of those places are kind of dark and scary, and then
Mm-hmm.
you're like, oh wow, there's some stuff in there that's why this is really hard for me. And I'll
Yeah.
give you a really funny example. I mean, it's not funny, but it's a it's a beer related example. Okay, so I live in Asheville, North Carolina. Asheville, North Carolina is known for breweries, right? So all sorts of
Mm-hmm.
beer, really delicious beer. I cannot stand pilsners or lagers, right? Like on a level that's like not like any other beer I can like try out, and I just know I kind of have to stay away from those. And I had a friend, this was just last week actually, and he was like, "Oh, he's like, this is a really good one. Like this brewery is amazing. This is a fantastic lager." I'm like, "All right, let me try it. Maybe it will change my mind." I took like barely a sip. It was like when the smell hit me, like it was like a disgust response to it, right?
Mm-hmm.
And it was just like, what was that? And I thought about it a little bit more about over the next couple of days. And he's like, yeah, he's like, that was a strong reaction you had to that. And I said, I'm like, it's because it smells like the guys that tried to kiss me in the bar at college. Like it smells like it has undertones of light sexual assault,
Oh,
right?
yeah,
Like,
yeah.
and so it's like things like that like come up when you're like, oh, like that way of being touched or that way of
Mm-hmm.
having someone initiate with me or something like that actually is kind of repulsive to me. But if we haven't asked ourselves those questions and dove into them, we'll try to power through and then wonder what's wrong with us when we don't get turned on,
Yeah. That's
right?
heavy. That's a lot
Yeah.
to that's a lot to unpack. Um, and it's a lot to then process because then you got to
Mhm.
figure out how you want to, move through that after.
Right. So these
Yeah.
are these are not light questions that I throw
No.
out, and I don't actually mean for anyone to take those questions and just start journaling about them. If any of them intrigue you and you want to start, kind of like asking yourself those and working on it, like by all means go for it, but know that you might need some support around it.
Mm-hmm.
Because, we have a culture where a whole lot of things are hidden here and we cover it up and we hide it. But often with sexuality counseling education, um, and I can especially speak for the sexuality counseling program that I teach with Dr. Uchenna Osai. This is what we have our participants do, right? We have them like dive in and really, kind of our rule is you don't give anyone an assignment before until you've done it for yourself, so that you actually understand the emotional experience of asking yourself that question or having that conversation with a partner, right?
Mm-hmm.
I can't speak for everyone who is working as a sexuality counselor or, all of the different programs people have gone through. But if someone like on their website or, it talks about the programs they've gone through and they've done specific sexuality counseling training, whether it's like with a national certification or if they've done like a big program or something like that, likely it's going to be on their resume, likely it's going to be on their website somewhere. And that helps that they have probably asked themselves those questions,
Yeah.
because there's a lot of public therapists out there that it's like we get like the training around like just like medical sexuality, right? And then we
Mm-hmm.
jump into it, but we don't have like the psychosocial aspects of it. And so, like, that can kind of sometimes be hard when it's like they're all ready to hear about the problems you're having with pain or numbness or this or that. But the context around like your relationship structure or, the problem is with some sort of, like a more like a kinkier or a more intense activity that you want to be able to get back to that you don't know if you want to say out loud because you might be judged, like
Yeah.
those things are generally, you want to have someone who's had a little bit more training in like an actual sex counseling program, to
Mm-hmm.
increase the odds that they've had these conversations and they've been exposed to this stuff before you come and sit down with them in their office.
Yeah. It is a hard, and the suggestion of looking for that additional training is
Mhm.
really key because otherwise, how can you really know at all what they're prepared to discuss and how welcoming the environment would be,
Right.
especially when a patient's looking for, a clinic, a space, a therapist, where their whole identity is welcome and not just their anatomy.
Right.
you know?
Exactly. And it's tricky for sure. And and sometimes people are like, I'm LGBT affirming and stuff like that, but it doesn't necessarily mean that they've had any training of it. It just means that they're not going to be a jerk to you,
Yeah.
right? Or that they
Yeah.
don't think that they're going to be a jerk to
They
you.
don't think that's probably
Right.
the more accurate
Right.
way to
So,
state it.
yeah.
Yeah.
So that's definitely like those are also good things to see, but like seeing that they've had actual training around sexuality can be really helpful.
That's
And then during a first visit, like just asking them about some of their thing, and you can ask about, have you had much like training or conversations or done any coursework around like kink or relationship structures or or like power dynamics or like anti-racism or like any of those things that you feel like are really going to be important in your care. Like just ask them if they have done training in that, right?
mhm.
And then hopefully they'll have a really good like, yes, I've done this, or I've been reading this, or I've been listening to this, and they're not gonna just look at you like, what are you talking about? Right. Because that
Yeah.
what are you talking about look is like, not safe to discuss this.
That's a good, yellow flag, actually, and
Mhm.
I was gonna ask because the you're not gonna get the red flags are easy to see. Someone doesn't have any training, or they come across as not obviously not being inclusive. But what would you say some of the yellow flags are? We've talked about the green flags, but what would the yellow flags be that maybe a provider isn't equipped? Maybe they had training. We don't know. But what would be some like subtle things to look for?
If like so those yellow flags would be you're if the way that they ask their questions make you feel like you have to make a decision between either coming out or staying closeted at the risk of being judged. Like if you're
Okay.
feeling like that, those are definitely those yellow flag
Mm,
things
yeah.
because some
Yeah.
of that stuff is kind of like baked in, right?
Hmm.
Like some of the things are just like, oh, how is sex working for you? Blah, blah, blah. And then it's like, okay, well, with your husband, right? Or with your wife, we're like making those assumptions where that hasn't actually been a thing. And that's maybe not a correct thing because
Yeah.
of, because then you put someone like, then as a patient, you're in that position of like, are they not cool with the option of me being gay? Are they not cool with the option of me having multiple partners? And so then you have to do kind of a quick little trust measurement and be like, okay, am I going to try to get the most authentic version of care I can by telling them the truth for me? Or am I just going to kind of sit on some of this stuff because I don't want my care to be affected negatively if they have judgments about the way I live my life?
Yeah.
Yeah. And sometimes you're probably just fine to like just say the thing, but it's a calculation, you
Hmm.
know.
Yeah, especially with if people want to talk about like a particular like kink practice they want to get back into. Do you
Mhm.
have any suggestions for how people would navigate that conversation if they're trying to go in and talk to a healthcare provider about it?
Yeah. So if we're talking about a kink practice that maybe let's say they're in a small town and they don't have very many options about who they go to, right?
That's practical.
Yeah.
Hmm.
And so here's the pelvic PT in town. They have a pretty good rapport with this person. And let's say, for an example, a thing that they really enjoy doing is fisting, right? Like, say, vaginal fisting, which is something that makes a lot of people go, like, oh, right? Like, big response to. So,
Hmm.
if that's a thing to where it's like, all of a sudden that's been something that you've been having a hard time like receiving again, right? And you want to be able to get back to it, like you need to be able to talk to your provider about like a larger than our, like we're not talking about like biggest dilator size, right? Like this
Hmm.
is a change in your status that is a little more varsity level, right?
Hmm.
So what I would suggest would be to have a way of like kind of letting them know, giving them a heads up of like, okay, so there's a thing that I enjoy doing that is a little out of the norm, and it might not be something that is in your wheelhouse. However, I can explain to you what it entails if you're open to hearing about that so that you can help me problem solve it. Because I think a lot of times the wall that patients get is their therapist or their medical provider feeling incompetent, right? By
Yeah.
like, oh, they're asking me about something I have no idea. So am I going to fake it, or am I going to try to be like, oh, like, no, or throw some judgment out to let them know that, like, oh, no, this is not okay. We don't talk about this. But really, it's just because I have no idea how to talk about it. Right.
Yeah. Yeah. Yeah.
So
Hmm.
if it can be prefaced a little bit with like a, hey, I know this is kind of like an out of the ordinary thing, but if like I can help explain this to you, like I'm not expecting you to know about this particular thing, you know, I would like to be able to explain it to you and know that like this is something that I enjoy, that arouses me, like, so that you're kind of like crossing off all of the, like, this is not an abusive situation, right?
Hmm.
Because that's a lot of times with our, what our head goes to when we hear like, these more extreme sex acts. It's like, oh my gosh, is this an abusive situation? Is this causing damage? Is this, and so your medical provider, as someone who is trying to like reduce harm to your body, is going to like take that side first, right?
Hmm.
And so we want to make sure that we kind of like can like know like this is something, and this is always like, this has been something that has worked really well for me in the past. It's always been great, but here's what this thing is, and here's where I'm having the problems. So like
Yeah.
as many ways as you can kind of like already have it like digested down to like the specific pieces of it is going to be really helpful for your practitioner to be able to like help you problem solve the part of it that's actually problematic.
Yeah. That's such good advice for not just talking about a particular kink practice, but just getting your medical history out to someone and
Mm-hmm.
having that be the most, lean, description as possible, almost bullet pointed, if you will,
Right.
because there's also can be a feeling of little time. And if you're used to not being attended to in appointments and being dismissed, this is like, feels like an extremely high stakes situation to
Yeah.
be bringing your concerns into a provider.
Yeah.
Yeah.
And some of the ways that I like to train my providers to listen, like when I'm teaching providers how to do this, is like having them listen to people and understand that the like, well, what are the physical pieces of this that are going on? What are the like erotic pieces? But when I say erotic, I mean like the sense of self. Like what are the words that you're hearing that are like, I just don't feel like myself anymore. Or I used to be able to enjoy all these things and now I just can't, and things feel more dull, or these things where we just know like where our life juice is draining out of us, right? And
Yeah.
then also, what are the relational aspects and components of it? So those are the pieces that are all usually relevant to any of the sexual dysfunction and distress that we're trying to assess. So for any of you listening, if you can think about like the things that you're stressed about, if you're having painful sex, right? Go ahead and kind of think about those things like, okay, so what are like the physical aspects? Like when does it hurt? Why? These are the questions you're going to get asked, right? Like break it down like you're in a forensics lab a little bit. Like, so think through like, oh, it's really not at the beginning, right? It happens after a while and it's only with this sort of act, right? So as
Mm-hmm.
much as you can like already have broken down, and then like the how does it make you feel when you can't do this, right? Like, is this just like an annoyance, or is it just like it's just painful? Like everything else, I still feel sexy as hell, but like I just want this thing to work, right? Or is it like, oh, I just feel like I can't, like I'm just not myself, like I can't access myself, I don't feel sexy, I feel like things are broken, like is that a big component of it? Because that's really relevant. And then how is this affecting your relationship, or how is your relationship supporting or making this harder?
Yeah.
So
You just hit on something that's so important, and I was actually going to ask about it. So let's just like go into it next. And
right.
it was really centered around pleasure, pain, and healing.
Mm-hmm.
And of course, we're talking about sexual health, but in the context of that is the pelvis and pelvic health and the pelvic floor connection. And so many people come into pelvic floor therapy, pelvic health, believing pain is their fault, or
Mm-hmm.
proof that like they're broken or something like that. How do you help patients reframe pain, or arousal changes, orgasm challenges as medical and not like moral,
Moral failings, right?
Yes, exactly.
Curses, right?
Yeah.
Yeah, because all of that happens. And like for any of the providers that might be listening to this, like you need to know if that's part of what is going on,
Mm-hmm.
right? Like you need to know if this is actually landing as a moral failing for
Mm-hmm.
someone,
Mm-hmm.
because that's really going to adjust the way that you talk to them and adjust the way that you manage that. And, so for any of your patients, like if it does feel like a moral failing, if you do feel broken or like this is a punishment for something bad that you have done, which often comes with sexuality stuff, right? Like I had an affair and now I can't get an erection, right?
Mm-hmm.
Like there are biological and it's like psychosocial reasons why all of those things happen. And it's not just like a punishment,
Yeah.
So
Yeah.
understanding that's not what's going on. Okay.
Yeah.
Might be the way that you're processing what's happened, or it might be your feelings around it, and but talking to your provider about that, they can help you figure out where to go to help manage those aspects of it, because there might be a piece of it to where you might need to talk to a therapist about some shame around something that happened. We're kind of unpacking some stuff that is holding you back, or getting out of, if you're having like perseverating thoughts around something every time you get aroused, and then you get this thing, right? Like that might be something that you need professional help to unpack, right?
Yeah. Yeah. Because, pelvic therapy, pelvic PT, pelvic OT can carry us a certain distance. And then
Mhm.
obviously there's, sexual counseling beyond that and therapy. Um,
Mhm.
but pelvic health and therapy specifically tries to support sexual liberation, confidence, embodied pleasure, and all those things. But then you come up against, and this is something else you just mentioned. So I just want to draw this little piece out, which is about shame,
Mhm.
like dismantling shame. So we can throw that, pelvic PTOT ball as far as we can get it. And then there's, okay, you've got a bigger issue
Mhm.
on dismantling shame and reclaiming, sexual autonomy.
Mhm.
And so you often talk about how shame reinforces that silence and keeps people from seeking help. And
Mhm.
I'm wondering, like, is there practical exercise, listeners can do like now, today, to start detaching from those shame-based sexual beliefs?
Yeah, I mean, wouldn't it be cool if you could just detach from your
I
shame,
know.
right?
I
Like
know.
that line
It's
you just said,
so
like, yeah,
like,
let's do that today.
yeah, just mired up.
Right.
How do you start the conversation? Because you feel that, when people are bringing that stuff in, and anytime people are
Yeah.
talking about sexual health, I mean, it's obviously going to come up. They think that they're wrong, they're broken, moral failing, lots of shame,
Mhm.
and there goes the snowball, right? And it's just getting
Right.
bigger and bigger. Now what do we do?
So accessing that, or like being able to like acknowledge that that is what you're feeling. Like if you like naming, like, what is this that I like, why am I afraid to talk to my pelvic therapist about
Mm-hmm.
this thing that's happening? Or why am I only telling them part of the story and not part and more of the story? Right.
Yeah,
And so if you can kind of like, you're like, because I don't want to like dive into I don't want to talk about it. Right. And so it's like, is it that maybe need to dive into that with someone else, right? Or I need to start journaling about that, or like kind of seeing like what's in that, like why is this such a block for me, is it shame? Because you can absolutely talk to your therapist or your pelvic therapist, your pelvic health provider, and say like, hey, I have a lot of shame around this, right? Like
yeah,
that is shining the light on it. Anything you can do to shine the light on the shame and the hard stuff is going to be like the first step to help you move out of it. So you can name those things with your provider. And chances are your provider has a whole lot of things they also feel shame about.
yeah,
This is a universal human experience. You know, as providers, as medical providers and sex counselors, we don't necessarily dive into, like helping people through like their like deeper therapeutic things when it comes to, shame and betrayal and stuff like that. But what we can do is normalize and educate people on the different aspects. Like I feel like if someone is feeling shame because they're only able to orgasm with clitoral stimulation and they can't ever orgasm with vaginal stimulation, oh, pelvic PTs, we can absolutely help to
yeah,
discuss that shame, right? And
Mm-hmm.
so some of those pieces, like some basic like physiological education and education about how orgasm and arousal and desire and all of that work are pretty great. Emily Nagoski has this really beautiful metaphor that she uses around a garden. And it's like we all have our garden, right? And like our garden has been growing since we were born, and we didn't have any say about what was planted in that garden. But now our garden is ours, right? And this garden is our sexuality, our sexual selves, like our sense of who we are. And there's a lot of weeds growing in there. And like it's not, we're not responsible for how they got there, but
Yeah.
now we do need to tend to them, right? And figure out what we want to plant instead, right?
That's good.
So
Yeah.
just because your garden might be overgrown with stuff that you don't want in there, that doesn't mean your garden is lost, right? It just
Yeah.
means we need to like, here's this and here's how we need to manage this and here's what we can do instead to plant something that's going to not let that other stuff grow in place.
Yeah.
Right. And
Oh gosh. Were you going to say one more thing?
I think I was going to talk a little bit about it, like one other aspect with this whole like
Mm-hmm.
the feeling broken,
Mm-hmm.
right? Or feeling like something is like, well, especially the brokenness. So often in like our Western culture, we have like one path to successful sex, right? Like it's this default thing. And whatever it is for people, like when that path stops working, we feel broken, right? So if
Yeah.
it involves a wet vagina and an erect penis, and those things can do their thing together until everyone has an orgasm and that equals successful sex, there are so many ways for that sex to be broken,
Yeah. Yeah.
right? And
Mm-hmm.
that doesn't mean that like that you're broken. It means that you chose a tight wire or a tightrope as your version of sexuality, and sometimes you can't keep balancing on that.
That's a good way to put it.
Yeah.
I was about to say something, ask a question related to that. So this is a perfect segue.
This episode is brought to you by Fringe, the makers of the Fringe Light Therapy Pelvic Wand and their innovative light therapy wraps. The pelvic wand is an intravaginal device that uses red, near-infrared, and blue light, plus gentle vibration to support pelvic and sexual health from the inside out. Their medical-grade light therapy wrap can also be used over the lower abdomen or anywhere you're feeling pain. Both are natural, non-invasive tools shown to reduce pain, relax tight muscles, boost blood flow and lubrication, and support healthier, more resilient tissues. And yes, they're trusted by medical professionals and backed by research. The best combination. Learn more at fringeheals.com. That's FRINGEHEALS.com, and use code VOCAL for 10% off.
I was going to ask how people can give themselves permission to define sex outside that kind of heteronormative standard or expectation, that tightrope kind of thing. Yeah.
Yeah. So learning that there are just so many more things on the menu. But like instead of focusing on the goal of what is like what we think sex should be, right? Like it's the baseball thing, right? There's like first base, second base, third base, home run, right? Which is an absolutely terrible metaphor for sex, because
Totally.
you have, like, so you have a team that wins and a team that gave up a run, right? Like, who wants to give up a run? Like, it's terrible. But yet, like, that's still like kind of ingrained into this is how it works. And if we didn't do that whole thing, then it didn't count as sex.
Mm-hmm.
Right. So, and that's that, like the just to generalize that as like the heteronormative script for sexuality. But that doesn't mean that only straight people do that. Right. Like that script is in there for all of us, regardless of orientation.
Yeah.
Right. That there are things that happen and this is how we have sex. It is a lot easier for queer people to avoid this script, because we like often a queer couple will have different anatomy or will feel differently about their own anatomy and how they want to use it. And so the nature of like just kind of coming up with like, oh, well, let's do these things because we like these things and these are the parts we have and this is how we feel good together.
Yeah.
Is a lot more natural when there's not like, you know, you know, in the case of two women, right? If you don't have to tend to a penis during sex, like if no one cares if there's an erect penis and how the
Mhm.
penis is doing, and you know, then it's like, oh wow, there's a whole lot of freedom in that, right?
Yeah.
So you can kind of like take turns and like, you know, have a little more playfulness in sex. But the thing is, like those same concepts are really fantastic for straight couples too, you know, that
Mhm.
like just not centering an entire sexual experience around eventually getting to penetration, and then penetration has to happen until the one who is penetrating has an orgasm, right?
Yeah. Yeah.
Because like there's just, I mean, and it might not be good for anyone, right? Like the person who is having an orgasm might prefer to have an orgasm in another way, but
In
like this
another
is the
way.
way we're supposed to do it, you know?
Yeah.
And like, and also it might be such that like for the person who is receiving penetration, it might feel just fine for like 5 minutes, right? 3 minutes. But then after that, you get like bored or irritated, or you need more lubrication, but you don't want to like bust the flow because then you put 5 more minutes on the clock, you know? Right. So,
Yeah.
so
Yeah.
just like recognizing that whenever we have like these points that feel annoying in sex, that you cannot do those. Like you can like not do the things you don't like.
That's worth
Right.
stating again.
Yeah.
Yeah.
Yeah, even like I'm like, how can I just talk about any sex acts here? Is that okay?
Oh, yes.
Right.
Yeah.
So like with the blowjob, for example, right? Often you don't talk to many women who are super excited about giving blowjobs. And it's usually because of like orthopedic challenges, right? It's like your jaw hurts. It takes too long. It's like there's a lot of labor. There's things that go into it. It's really fun for a little while, but like it gets old, you know, and then you have to like, do you have to do it until he's there? And oh my gosh, am I doing it right? Did I, you know, there's all
Yeah.
sorts of pieces, but you can like maybe just do the parts that you really enjoy and then change to something else and then come back to it and do the parts you really enjoy and then
Mhm.
change to something else, you know,
Mhm.
so that you're not having to turn sex into non-pleasurable labor, you know?
Yes.
Because
Yeah.
often the things that we like when someone is doing a sex act on us is we want them to be really into it.
Yeah.
So the thing that we can give our partners is to keep ourselves in a place to where we're really into the things that we're doing with them,
Mhm.
right? So that means
Mhm.
they need to be pleasurable, right? So, and
Mhm.
sometimes that takes communication and conversations outside of the bedroom, you know, about like what feels good and what you would enjoy. So often, you know, when we talk to clients about like what it is that they want from like sexual connection, it's usually, or from like for sexual activity, it's usually connection,
Connection.
right? It's usually, well,
Mhm.
this is how I let my partner know I love them.
Yeah.
You know, this is what, but then it's like, okay, so this is how you let your partner know that you love them. But really what it is a hamstring cramp and some neck pain and carpal tunnel flaring up, right? Like, no,
Oh,
that
that's
is
good.
not what we want.
That
So
is no, that is no. Nobody has time for that.
nobody has time for that.
No.
So do the things that feel good. And
Yeah.
that might be like looking outside of the box for stuff. Sensory play is, I think, the most overlooked,
I
most fantastic piece of sex.
Yeah, I agree. I agree.
Yeah. And for
Yeah.
anyone who's listening who's like, sensory play, what the heck does that
What the
mean?
heck? Yeah. Yeah.
Right.
Talk to the listeners about this for a second. But I think, gosh, that you hit on something here that's really important.
Yeah. So like sensory play is just like taking turns, making each other feel really good in fun and playful ways, right? So like it can, and usually like using some sort of apparatuses, and it can be
Yeah.
anything like this. It can be it can be kinky if you want, but it can also be just like real sweet. Like you can use like cotton balls and maybe a pair, like a silk scarf, and maybe like, a fork or something for something different, maybe something that you've like a spoon that you've had in cold water and a spoon that you've had in like warm water, right? So that you can kind of play with some temperature things, maybe a spray bottle where you like spritz someone and blow on it, but just kind of like, and you can even put them in a blindfold so they can't see. And
See
then
what's
you're just
coming.
going to do all of these fun things to like create this really fun and exciting experience for one another. And often what that does is it reminds you that you have skin,
Yeah.
and that you have a
Yeah.
brain,
Yeah.
and that those things are deeply connected, and it can be highly erotic and very arousing to get yourself a kind of in this place to where it's like your skin is just so alive and you're just enjoying every piece of what is happening to you, right?
Like, yeah. It
So,
can teach
and
you so much about it. It's almost like I don't want to say it's a gap filler, but it teaches you so much about also redefining, what sex is, that's non-penetrative, et cetera. And I have a follow-up question to that. But there's this huge like Grand Canyon worth of stuff that people are overlooking, and
Mhm.
that's where the sensory category can definitely come in.
Yeah, and people can start to understand like I really like doing this to my partner, or I
Mm-hmm.
really like receiving this and just having no idea what they're going to do next. Or I really like receiving this, but as long as I can have some control over how hard or where on my body, right? So you can start like in a much lower consequence environment, start figuring out like, oh, this really works for me. I
Yeah.
always thought I wanted to receive, but really, I really like to do the thing, you know?
Yeah, yeah.
Yeah. So you
That's
can,
that is important, in terms of like roles, because you often get stuck in the same thing,
yeah.
again and again. And that was kind of my follow-up question too, was I wanted to kind of segue into like real world stories where people have like they've arrived. I mean, we're all
Mhm.
arriving at any given moment, to get esoteric just a little bit. But when they truly feel like they're somewhat like liberated, I guess might be the word. Can you share like examples of,
Yeah.
cases, obviously anonymous and stuff, who didn't know, about non-penetrative sex, that counted, or who discovered new pathways to pleasure? I mean, I'm sure you've got more
Yeah.
than enough stories.
Yes. I have a favorite one.
Okay.
Um, so, well, yeah, I'm like, oh, wait, but there's this other one that's really good too.
You can
But
tell two stories.
I know. Okay. So, okay. So first I'm going to tell the story of a patient who wanted to be able to have sex that wasn't painful with her husband. And the situation was that they did not have a great relationship. She acknowledged this. She was not particularly fond of her husband,
Hmm.
but it was one of those situations to where he was much less grumpy if she had sex with him on a fairly regular basis, like once a week, let's say, right? So she was coming. She's like, look, I don't need it to feel good. I just need it not to hurt so bad. Right.
Oh gosh.
She
Yeah.
didn't care. So pleasure was nowhere on her map. Right.
Hmm.
She'd never had an orgasm, like any of those
Oh
pieces.
my gosh.
Right.
Yeah.
So so we just did a basic talk through about like anatomy and arousal. And I introduced her to her clitoris, and just kind of like talked to her about like pleasure and like what pleasurable sensations can feel like. Because as we know, like for sex to feel better, you need to be aroused, right? And
Yeah.
there wasn't much that was happening for arousal for her within these sexual encounters. And so, so that was going to be on her to figure out how she could get herself aroused to go into these situations. So she needed to really understand her body and how to do it. So I suggested some self pleasure things for her just to start to understand those. And like I gave her a couple basic tips. She went away and she was like at her friend's house for a couple weeks, and she bought a vibrator and she tried the things, and she came back and she was like, oh my gosh, I've had so many orgasms. Like, this is amazing, you know?
Oh, that's
And
so good.
so, yeah, but then so then I said to her, I'm like, all right, so let's figure out how we can incorporate this into sex with your husband. You know what she said, Ginger? She said, I'm having the best sex of my life. He doesn't get this.
Oh my.
Right.
Wow.
So she kept that part for herself, but she understood now her body and how to get it to a point that it would keep things from hurting for her from him
Yeah.
while still keeping her erotic self for herself
For
and
herself.
not, yeah.
Yeah.
So like,
Gosh, that's
I loved that for her. And, I want
yeah.
more for her with the partnership, but like that was where she was, right? Because we
Right,
meet people
right.
where we are, where they are.
That's a really good story too, because it's not like everyone's going to, have a liberation story where they find,
Mhm.
and there's no perfect partner, et cetera, whatever. But people have to stay in different situations for different reasons. And
Right.
I love that story for that reason. I mean, she found a place that works for her.
Yep.
No judgment. That's what works for her. That's a beautiful thing.
Yeah, and that's the piece that gets lost when we go into our normative questioning and we attach sexuality to acts that they do with their partner,
Yeah.
right? So this is why it's really important for when we talk with, when we think about sexuality, it's our experience,
Mm-hmm.
like our pleasure, like our ability to be aroused, our ability to feel desire, our ability to have an orgasm. Like when we attach those to other people, like that is not generally the equation that's going to work,
Yeah.
so it's sorting your own things out.
That self exploration is true in so many areas of life and particularly sexually. And I know that you and I probably have a lot of other stories too about patients coming in and not even being comfortable getting to the point where they can even look at what's down there and then get to the point where they can practice any level of touch, et cetera, for arousal, et cetera. So I think
Mhm.
that it's, I don't know how would you say if someone is uncomfortable with that and they've never explored that, just self pleasure,
Mhm.
because that's about their self care and creating that space where they know how they enjoy things and then they learn what they want and don't want.
Yeah,
If someone's very uncomfortable with that notion, because so many women were also taught that, their
that's not
bodies were
okay.
basically for their partner's pleasure and not their own, which is
Mhm.
a whole other thing we need to dismantle. How do you go about talking to them about that? I mean, I've had obviously plenty of patients like that.
Right.
But I think it's important to draw out because not everyone can just feel comfortable with saying, oh, I'm just going to go pick up a vibrator and get on with things.
And it often doesn't work like that,
Yeah.
right? Like you kind of have to be at a certain place for the grab a vibrator and try
Mm-hmm.
some things out to work, right? If we have shame and we feel like vibrators are dirty, like even if it works, then it might feel worse, you know?
Yeah. Yeah.
Um,
Yeah.
so, yeah. So when it comes to that, there are like a couple like if someone is like actually feels like repulsion to that, like I am not going to in any way push anyone to do something that they are not comfortable with
Yeah.
or even like suggest it. So usually with those people, what it will, and not just with those people, but with people who need to kind of get into like understanding pleasure, we do non-sexual pleasure, right? It's that like the sensual showers, the washing your hands, the like, smelling, like, the smelling the flowers, the walking outside, the feeling the sunshine, the like the finding those moments that you get lost in that feel really good and amazing, the enjoying touch, like, and you can also just figure out like self exploration with your skin and what feels nice and what senses feel good to you, like what do you like to smell, so there's all sorts of different ways that you can practice self pleasure that don't have anything to do with your genitals, right?
Yeah.
Because it's that act of understanding what is pleasure to you, what
Mm-hmm.
are the things that you like. So that's a place that I like to go. Another place that I like to go with it is like if someone is like, well, I've just never done that before and I don't really see a point to it, but there's no like repulsion to it, right? Then is starting like explaining to them like the physiological reasons to why understanding your own arousal and how it works is like taking your genitals for a jog, right? Like you get increased blood flow and you're getting all of those things to happen, and you're understanding, how like, oh, this kind of clitoral stimulation feels really good and makes me have the responses that I need to make sex feel better with a partner, right?
Yeah. Yeah.
So using a very anatomical, physiological, this is the medicine for what you're coming to see me for. Because sometimes it is just permission, right? People need like
True.
permission and a reason to be
Mhm.
able to do that.
And these stories really teach us about how powerful it is to, unlearn those old scripts and
Mhm.
move forward.
For sure.
Yeah. Here's a question I have.
Mhm.
And then I want to hear about, your program and how you got into it. I want to hear more about that. But one final question I have about people going into the clinic and, to the therapy practice, whatever it is, to seek help. What's a boundary statement that a listener can use if they feel minimized, dismissed, or misunderstood? Because I mean, it's going to happen at some point.
Right. Oh, geez. So, I mean, I think a lot of that depends on like the nature. Like, do you want to address it or do you not? Right? Like, is it something
Hmm.
where I'm just going to find another provider because this doesn't feel
Yeah.
safe, and like you can always leave, you
Like,
know?
yeah. Yeah.
It can be hard, but like, you can. Some of the things around boundaries might be, just like settings like, hey, I need the door to stay open. I need like it would feel better for me if I was seated here in the room, or like this air freshener is a lot for me, or these overhead lights are really stressful for me right now. Is there any chance we can have the lights off, or do you have a different form of lighting, or is there a dimmer? Right.
Hmm.
Some of those can be boundaries where you're keeping your nervous system in a much safer place, that you can absolutely ask for. Um, some of the other, like the thing with some of the other boundaries when it comes to like how someone's interacting with you is like they have to have the education and maturity to be able to hold those boundaries or respect them or understand them.
Yeah.
And so that's like, that's the thing. I'm like, am I going to ask for this thing I need? Or do I not think that is, if I ask for that, do I feel like that's actually going to be more emotional labor for me? And I just want to
Mm.
not do
Hmm.
that. Right.
That's a good question to ask yourself. Is it going to be, are you going to be carrying too much emotional labor or mental burden or however? Yeah. Yeah.
Right.
That's a really good question.
Yeah.
So, all right. I have about 3 more questions left.
And it didn't even get to my second story. I know.
Oh my
Yeah.
gosh. Is it a long story? Do we have time for it?
I can maybe do a very fast version of it.
Okay. All right. I got to hear it. Let's hear it.
Okay. So this was a male patient who was maybe like 60-ish who came in to see me. And the reason, and this was a coaching client, just to be specific. This was not a pelvic PT client, but
Okay.
he sought my services because he had just started dating a new partner, and she had the most amazing orgasms he had ever seen. And he's like said, I don't know what is happening for her, but I know that I have never felt that way. And I want to figure out how I can do that. He said, I feel like I'm always so concerned about if my penis is hard enough, or like what's going, like I'm so concerned about my performance and not coming
Yeah.
too early or all of that. He's like, I have never been able to let go of myself the way that I see her letting go. Right.
Mm.
Which I'm like, oh my gosh, dream client here, right?
Yeah.
You know,
Yeah.
so it was so much fun to go through and like bust down some of the myths around him, around things and everything. And then I got to also talk to his partner, and they were really curious and like just doing some like anal exploration. And I was so glad I got to talk to them at this point, because so often when straight couples want to do that, they just decide that they're going to just go for it. And it's like, oh, let's take 5 steps before we
Yeah.
even do that. Right.
Yeah.
And
Yeah.
and so I kind of talked them through just doing a like both of them just doing external stimulation in ways that feel good and kind of guiding each other, just just around the outside of their anuses so that they can like just feel that vulnerability and like make sure that that feels nice and something that they actually wanted to do more of, right? And can they,
Mhm.
do they feel like they can relax, or do they feel like they can tense, just to kind of test the water. So
Yeah.
they did this session, right? And with the stimulation that he was able to just give her like outside, and like it just kind of got real hot and heavy, and she had like the best orgasm of her life, right? Is
Wow.
what she had said. And he was so excited, and I asked him, I said, so like, what did your penis have to do? He said, absolutely nothing. so,
Love
so
it.
it was great to just kind of for him to have that experience, and so like he could like let go of
Let
like
go.
all of like his expectations around performance, and realize that they could just both dance in this delicious pleasure, and just figuring out each other's bodies and what feels good, and how they can not have to focus on the stuff that's hard together. So yeah, there
Yeah.
we go.
Oh, that's awesome.
Yeah.
I'm so glad that you stopped me to do that story. I absolutely love that. That is so great. So that's like hope. All right, everyone.
Right.
Hope, hope, hope. Um, the next, what I was going to really shore up with, before I ask about, tell us a little bit about your program, and if someone wants to pursue that, or someone wants to pursue, coaching with you. But before we get to that, for the person listening who has felt shame, brokenness, or
Mhm.
silence about sexual dysfunction, what do you want them to know right now?
I want them to know that what they're feeling is very valid, right? There are lots of reasons why they're having those feelings right now, and why they're so hard to deal with, and all of that. And that there's a couple different pieces in it that can really help them move forward. One is that sometimes what happens is we need to actually grieve the way that the expectations we had around what we thought sex was going to be, or what sex used to be and is different now, right? So letting go of realizing that this one projection of what we had hoped or what we wanted to continue is maybe not there anymore, or maybe it's going to be different for us, right? And that it's okay to grieve and actually like have a ceremony around letting go of some of those expectations, while also doing some of the work on realizing that some of those expectations were maybe like not great for us, right? And so some of those, like, where did those expectations come from, and how can we like both grieve letting go of them, but then also be a little bit critical of what those are, so that we could step into our next phase of like actually creating a sex life that involves things that feel good, right? So
Yeah.
the things that we enjoy and the things that we want. And it's probably going to put you on a path to like starting to explore things that maybe you didn't know were possible, or like ways that you can feel that like you had just crossed off because you had this one kind of narrow version of what you thought sexuality could be, and that version got broken. But like the secret in that is that when you have that narrow version of sexuality, is it gets broken for everyone. Like at some point it's going to break,
Yeah. Yeah.
right?
Yeah.
So if we actually want a resilient sex life, okay, which includes connection and pleasure, ongoing with a partner or multiple partners, or if you're, dating, like all of this, if we actually want this resilient version of sexuality, it has to break. Like that version of that narrow
It's big.
version of what sex is has to break in
Mm-hmm.
order for us to go beyond that and have a much more resilient sex life. So, like,
That's pretty important.
you got this, you
Yeah.
know, and it's going to look different. Like at different stages of your life, it's going to look different.
Yeah. That's such a good message, because people say trite things like what doesn't kill you make you stronger, that kind of thing.
Mm.
But I will, you know, often it's like, no, you're strong and you're like thriving in spite of what has happened to you, instead of leading people to believe that, these things that are hard or are meant to be there for something. That's like Kate Bowler, her work. Everything happens for a reason. And other, like, it's a title of her book. Have you seen that book?
Mm-mm.
Kate Bowler. Everything happens for a reason, and other lies I've believed.
Right. Yeah, exactly.
It's like that, and I think that a question that spins out for me after that is, then what is one step, that a next step, the conversation to initiate it, that if someone wanted to, the listener wanted to say, I'm ready to talk about this. What's the one
Mhm.
conversation that they should initiate this week, whether it's a partner, a provider, or maybe most importantly themselves?
Yeah. Like, it depends on what that broken point is,
Mm-hmm.
right? And I would probably say, like, I don't want this to be like a generic answer, but it's, what is my care team that's going to help me get to that place, and how do I take the first step into finding the right sort of help,
Yeah.
right? It's because it's like, a lot of this stuff, there is professional assistance that can be wildly helpful for, to understand what's going on with your body, what's going on with your mind, what's going on with your relationship, what's going on with the connection. If you have the ability to do that, to kind of go in and, like, start looking for additional care providers to help you get started, like, what's holding you back from that would be my first question, right? From
Mm-hmm.
seeking the help you need. Um, yeah, I mean, I think that's the first question, is what's holding me back? And maybe like what can I see that would be on the other side of me addressing this,
Yeah. And
you
I think that
know?
works for a question to themselves, what's
Mhm.
holding them back, a question for a partner, and
Mhm.
then, of course, certainly for the care team. Um, but I think that we could all take that exercise and just take a next step, regardless of where you think the status of your sexual health is currently, because I don't know a human being on the planet that wouldn't want that to grow. So it's applicable to everyone.
It really is.
Yeah.
Yeah.
So tell me a little bit about your program,
Okay.
how people can sign up for that, learn more about that, and then obviously where they can find you again. Yeah.
Great. Yeah. So as far as my program for professionals, it's through Pelvic Global, and it's called the Pelvic Health Sexuality Counseling Certification. And so it's for any sexual health professionals that are, or pelvic health professionals that are working with people, where we kind of designed it so that it's like, if you're working with people and working with their genitals, like, more specifically, because that's a very different version of a medical relationship
Mm-hmm.
than just, prescribing medications or doing talk therapy or things like that, right?
Mm-hmm.
So it's like, we're doing this physical hands-on work with folks, and we're helping them with their sexuality. So, and I've talked a little bit about it, but what we try to do is get providers to really, like, explore who they are and why they're there, and what brings them to the place in their own personal lives that they are in their own personal story of sexuality, right? So that they're doing the work that they're going to ask their patients to do.
Yeah,
Because again, we don't understand how hard this stuff is until we actually do it. And so we
definitely.
don't want to be just out there like, oh yeah, here's 3 different pieces of assignment, of homework that
Mm-hmm.
I want you to do, and bring the answers back to me next week, when those are, like, super deep and vulnerable and hard to do. Um,
Yeah.
yeah. So
Yeah.
we really try to give our practitioners that come to work with us a big, like, kind of historical understanding of what sex and sexuality and like the social determinants of health are, and how sexual health is absolutely part of our overall health. And then giving them lots of different ways that they can work with people around their physical, their psychosocial, and their relational health. Um, yeah, so I don't feel like I did a very clear example of that, but yeah, it's a 3-month program
Okay.
that we see, medical pelvic health providers with. So
I love that you have created this pathway, because there are so many pelvic providers out there that don't feel like they have that, well-rounded information. And then it gets to be a place where, it's not that they're not welcoming to the patient, but it feels like they're out of the boundary of what their comfort level is. And then that changes the energy and the dynamic in the room instead of being in a comfortable place. So I love that pathway. And I'm so glad you've created it. Tell everyone again where you can find the program and then where they can find you.
So you can go to pelvicglobal.com and click on courses and find it that way, or you can go directly to it if you go to pelvicsexcounseling.com. Okay. So yeah, those are the options for that. We do cohorts. Our next cohort will be starting in May. We do a January, May, and September cohort each year.
Okay. Awesome.
And we're on cohort 10 already. Seems
Congratulations.
Crazy. Thanks.
Yeah. Oh my gosh.
Yeah.
And well, thank you. Oh, yeah. Go ahead.
And as far as like working with individuals, so I do coaching with individuals that is online. And if anyone is curious about reaching out to me, I use a very like educational based thing. A lot of the things we talked about here are this is the kind of ways in which I work with clients, giving them ideas and how to move forward and breaking down and problem solving and seeing what we can do moving forward and busting down any of their myths that are holding them back. But they can just email me at info@heatheredwardscreations.com.
Okay.
For that.
I can't thank you enough, Heather, for coming on and doing this 2-part series, for coming back around again and finishing all these questions. I think that this conversation was, just as critical as the first one, and so informative and enlightening. And also you delivered that message in such a way that it makes everything so much more accessible to talk about it. It kind of destigmatizes the nature of what has historically, been taboo to talk about. So thank you so much for being here.
You are so welcome. And it was a delight. As you can tell, I always love talking about this stuff. So I appreciate you giving me some space and asking wonderful questions for your fantastic podcast. So I hope that it, I hope it lands and I hope people enjoy it.
Thank you. Hi, friends. Dr. Ginger here. I hope you're enjoying the episode. If you want to help keep the vocal pelvic floor running and support the important conversations we're having about pelvic and women's health, there are a couple of ways you can help. First, leaving us a 5-star review wherever you listen to podcasts really helps other people find the show and lets us know what you love. You can also make a donation through the link in our show notes. It goes directly toward covering production costs and making sure we can keep bringing you this content for free. And if you're a business interested in supporting the show while reaching our amazing community, we have advertising opportunities available too. Thank you for being a part of this journey with us. It really means so much.